Parkinson's Disease Dementia by Sarah Harrington, Nursing 341, Patient-Centered Care, Spring Arbor University, January 11th, 2019. Parkinson's disease dementia is the decline in thinking and reasoning that develops in many people living with Parkinson's at least 1 year after diagnosis. PPD, or Parkinson's disease dementia, only affects individuals that have Parkinson's disease. You cannot get PDD without the diagnosis of Parkinson's. It is estimated that 50 to 80% of all patients living with Parkinson's disease will experience dementia. There are several kinds of dementia. However, Parkinson's disease dementia, or PDD, only accounts for 5% of all cases. Alzheimer's disease accounts for more than half of all dementia diagnoses. Parkinson's disease is a long progressive degenerative disease of the central nervous system, mainly affecting the motor system. Symptoms are slow progressing, but usually start with shaking, rigidity, slow movements, and difficulty walking. Cognitive and behavioral changes, as well as the progression of dementia. The cause of this disease is unknown. However, there is evidence that indicates that cells in the brain called substantia nigra are destroyed over time. The current popular theory is that combinations of environmental and genetic factors are responsible for this neuronal cell alteration and destruction. The result of these interactions results in the loss of dopamine production, loss of neurons that make dopamine, loss of other neuron-generated substances, and the presence of Lewy bodies in the brain cells, all of which are found in autopsies of patients with Parkinson's disease. Stages of Parkinson's disease. One side of the body is affected in stage 1. Stage 2, both sides affected, but balance is intact. Stage 3, balance is impaired, but not independent functioning. Stage 4, walking or standing difficult without assistance. And Stage 5, bedridden or wheelchair-bound without assistance. Dementia will start to affect the patient in the first year. Clinical features of Parkinson's disease: head bent forward, tremors of the head, mask-like facial expression, drooling, rigidity, stoop posture, weight loss, tremor. Demographic for Parkinson's disease. Studies show men are more prone to getting Parkinson's disease, followed by dementia compared to women, specifically white men. Black and Asian communities are 50% less likely to be diagnosed. However, the Hispanic community has the second highest rate of Parkinson's disease. 60,000 Americans are diagnosed each year with the disease. However, since there is no definite test to indicate the disorder, many go undiagnosed. It has been shown that an inherited genetic predisposition plays a role, as well as jobs resulting in exposure to toxins. Unfortunately, as the disease progresses, so does the chance of dementia. Detecting the signs and symptoms early on will help maintain them easier, not just for you, the caretaker, but also the patient. Mental inflexibility, short-term memory loss, trouble with decision-making, executive function difficulty, slower response time with answers, difficulty learning new information, and disorientation in familiar surroundings. Other non-motor changes include agitation, anxiety, depression, sleep disturbances, and psychosis. A doctor must find that you have 2 or 3 cognitive areas in decline. These areas include disorientation, disorganization, language impairment, and memory loss. To make that diagnosis, a doctor or neurologist typically administers several mental skill challenges. Getting diagnosed. There is no definite test or exam to conclusively diagnose someone with Parkinson's disease dementia. However, if a patient has a diagnosis of Parkinson's disease already, the likelihood of getting dementia is already high. MRI and CT scans are used to look for any specific changes in brain function and appearance. Neurological functioning exams are also used as well. Patient may also see a psychiatrist when behavioral changes are present first cognitive changes. Treatment. There is no treatment for PDD. However, managing the side effects of the disease is advised. Patients can manage the disease by taking a variety of medications. The most common ones are Aricept, rivastigmine, and galantamine, carbidopa, amantadine, and bromocriptine. These specific drugs help with the motor and functioning side effects of Parkinson's disease, as well as the cognitive and behavioral changes. The use of antipsychotic medications should be used with caution. 50% of patients with PDD experience side effects. Antipsychotic medications includes Seroquel, Risperdal, and Abilify. Conclusion. After researching this disease in more depth, it is still obvious that there is quite a bit of unknown information in the medical field. Parkinson's disease has no cure as of 2019. Managing the symptoms is the best way to live more comfortably and to potentially prolong an individual's life. This diagnosis is not fatal and the progression is slow. If there is a family history of this disease as well as a history of dementia, you are more likely to develop this later in life.